Before you go under the knife or get injections, Dr. Ben and I are taking your burning beauty questions. We actually polled our audience on Facebook asking, what's your dream cosmetic procedure? And the majority you said, no surprise, liposuction. 30% of you said non-surgical skin tightening procedures. 18% of you said you wanted breast augmentation. And 12% of you said a face or neck lift. So I'm going to have to ask you, Ben, I know you're an operator, surgeon. I've come down to watch you work. What is your favorite treatment to make you look 10 years younger?
One is the Aura Lift, which is my form of deep plane face and neck lift. And deep plane really just means that we're separating those tissue layers that came down and bringing them back up, instead of that old school kind of pulling the skin and nothing else. Then I have another one called a weekend lift, and that's the smaller version where we're doing an internal lift without removing skin. But it really refreshes patients from here all the way down to the collarbone. And that's how you know you get a good lift, is the nasolabial folds look better, the jaw looks better, the neck, and even the collarbone gets brighter. That's a real lift. Everything came down together, everything's got to go up together.
That's why we're head and neck surgeons, right?
Oh yeah.
First.
Yes.
Plastic surgeons now. So when we do facelifts now, we want to preserve the hairline.
Oh yeah.
No removing of hair, and
I'm happy you said that.
make sure that all the scars, there are no straight lines in facelifting. Everything has to be a gentle curve hidden around the ears and the back of the ear, and if we're going into the hairline, following with the hairline. So something I want to pick your brain about. Beauty question. Chrissy Teigen recently got buccal fat removal. So Ben, going to you, in the right patient, is this a good option to slim and contour the face?
Yeah, so for the right patient, it's good, and the patients that I talk about are not patients who come in looking, slim, thin, and they just want contour. That's a bad patient to do it on. People do it for that reason, doesn't mean you should. What happens is the buccal fat is this beautiful, slippery, stem cell-rich fat that does not exist in other parts of the face, with the exception of the eye. The eye has a similar type of fat. Doesn't go away with age. Some people it becomes more prominent, but some facial fat compartments do shrink a touch. And if you're going to lose it with time anyways, why take it out? If you take it out on somebody early, they're going to get a deep depression here around the mouth because everything above supports what's below. So taking out the buccal fat early or excessively on someone can really bring it down. But if you do it tastefully, someone who's always going to be full and round and has an overly fat face, you can do it tastefully. You take out half of it, you close it up, and then instead of taking out all of it and going gung-ho, you just do a little skin tightening treatment on top of it. I just do half buccal fat, half profound, and that takes care of it. And they're healthy, they age well, but don't throw away the buccal fat.
Put it to good use.
Put it to good use. It's the most beautiful fat you have in your face. And people they go to the butt, they go to the stomach, they take out the fat, they throw it in their face. We do it if we have to. It's not a fully natural thing. It's much safer to take like and put it to like. So you take facial fat and you put it here. So I fill the under eyes with it. I fill the earlobes. You get a little shrinkage in the earlobes. Beautiful fat to use for that.
Now, obviously, you don't want to create waifs. This is not why we do this procedure. It's more for somebody that has those chipmunk cheeks.
Exactly. And what you don't want to do is these beautiful young 20, 25-year-olds who are already so beautiful and they're just, I really want that contour that I saw the Hadids had or whoever had. You don't want them doing it because they're 25, they're going to look 40 very, very quickly.